All right, everyone. It is 12 p.m. Mountain Time on Tuesday. So you know what that means. That means it's time for another continuing education session here at the Boise State University School of Public and Population Health. Thank you very much for joining us today. My name is Desmond Banks. I'm a clinical assistant professor and also chair of our continuing education committee. We're in for a very real treat today. Today, we're going to be having Dr. Ellen Schafer present on graduate education and public health. Dr. Schafer is our graduate program director here for our MPH program at the Boise State University School of Public and Population Health. So there's no better expert to speak on this topic. I know that I'm going to be listening with ears wide open. As an instructor, I received many requests from my wonderful students on writing a letter of recommendation, what to include, or even getting insights on choices in public health graduate degrees and the advantages and limitations. And I think definitely within the past 60 to 90 days here, we've definitely seen a shift. And so I'm just going to be delighted. I can't thank you enough, Dr. Schafer, for your willingness here today. Just a couple of ground setting rules. If you could please keep yourself on mute until it's time for question and answer. But please, throughout the presentation, feel free to put questions here within the chat, and we'll make sure that those are available and read aloud at the end of the presentation. All right. Thank you, everyone. And Dr. Schafer, I'll turn it over to you.
Okay, great. Thank you. Welcome. Yes, I am Ellen Schafer. I am the director of the Masters of Public Health program here at Boise State. And I have a few students who will be joining me today to talk a little bit about their experiences in graduate programs as well. So I have some slides where I'm going to ask for a little bit of interaction. So you can turn yourself off mute if you're able or want to at those points, or we can have a discussion through chat as well. So let's go ahead and get started. The panelists I have are in the second half of today's presentation, but I'll just tell you that so you know who they are on the call now. We have Charlene, Alan, Katie, Grace, and Brenna. They're all in different stages of getting a graduate degree in public health, and I look forward to them sharing their experiences with you in a bit. So the purpose of my presentation today is to provide just an overview of what's available in graduate level public health education, recognize and discuss some of the current headlines, some of the current challenges around funding and pursuing a graduate degree, to get some insight from me as a program director, and then also share the experiences, tips, comments, tricks, and just challenges, ideas, suggestions from the students. My purpose is not to sell you on getting a graduate degree or to sell you on Boise State, but it's possible both of those things could happen, in which case I would be more than happy to talk with you later after the presentation. Okay. So, and when we're talking about graduate degrees, typically we're talking about master's degrees and doctoral degrees. The two most common master's level degrees in public health is the Master of Public Health, or the MPH, and the Master of Science, or the MS, in public health. Previously at Boise State, before we had the MPH program, we had a Master of Health Science, so an MHS. So, it was kind of a mix between the MPH and the MS. So you might find different kinds of master's level degrees. And in so doing, trying to pick and figure out which one is right for you, it's helpful to know what their purposes are and where you might go with the different types of degrees. So with a Master of Public Health, it is typically more applied than a Master's of Science degree. Very practice focused, very interdisciplinary, and with MPH degrees, I think you'll find that across the board, they all include many of the same core courses. So courses in epidemiology and social and behavioral health and biostatistics. So regardless of where you go and get an MPH, many of the core courses are going to be the same. So often you can think that someone who has an MPH has a basic level of each of those areas. In addition, the MPH comes often with practical experience. We do have some MPH students that write a thesis and conduct their own original research. However, it is more common for MPH students to complete capstone projects and internships to really get that hands-on practical experience. So there are a variety of careers and paths that you could go down with a Master's of Public Health. Anything from working with government health departments or other public health agencies, NGOs, which are non-governmental organizations, so like nonprofits. We do have MPH trained people in healthcare settings, working in policy and advocacy and program management. On the flip side, if you were looking for something that's a little more research, data analytics, academic focused, then a Master's of Science in Public Health might be more what you're looking for. And it's typically specialized. So for an example, a Master's of Science in Public Health might be specialized in epidemiology or might be specialized in biostatistics. And so where you get the broad core courses in the MPH, you still take some of those courses in the Master's of Science program, but you're a little more specialized. Typically with the Master's of Science programs, you are also writing a thesis and doing original research. So some of the careers or paths that you might head down with that degree is research, working with data and policy analysis, maybe doing some technical consulting, or thinking about PhD programs. And you can think about doctoral degrees with an MPH as well. Many of the PhD and DRPH students have MPH degrees at the master's level. Then at the doctor level, the two most common are the Doctor of Public Health, or the DRPH, and the Doctor of Philosophy, or the PhD in Public Health. And again, sort of like how the MPH and the MS had some different orientations and different focuses, the DRPH tends to be more practice-based again. The curriculum is often around leadership and policy implementation, organizational management, and research. There isn't always a dissertation. Sometimes with DRPH programs, there is a large project or capstone at the end. But in either way, whether it's a dissertation or a project, the research is addressing some kind of a real world challenge. And not necessarily just thinking about, like, in the work that I do, I think about health behaviors and how social connections might influence health behaviors. And thinking about, a dissertation or capstone project with a DRPH, you might think about what that means in terms of the public health workforce, or how you could use some of those social connections in leadership and building networks and that kind of a thing. So very much still a research degree, just a different kind of focus. So the DRPH is ideal for people who are looking to be in leadership roles. And so often where they end up could be places like government agencies, nonprofits, global health institutions, healthcare organizations, and of course we have DRPH folks who end up in academia and do research and teach. So that's the DRPH side. The PhD, so the Doctor of Philosophy and Public Health side, is research oriented in that many of the classes that you take are preparing you to prepare, conduct, and defend a dissertation, which is original research adding to the literature. So the curriculum around that is heavy in research methods, data analysis and statistics, epidemiology, theory development, and then maybe some specialized courses in the health areas or populations that you're interested in working with. So the PhD is ideal for those who are interested in research, in teaching, and using data-driven studies to influence behavior and policy. So often, PhD folks end up in academic careers or working in research institutions, doing some higher level policy analysis and or consulting. So for each of the 4 degrees that we just kind of breezed through here, what I have on these slides are typical. They are just broad brush what you might expect for each of these 4 degrees. That does not mean that the degree you might be pursuing is that exactly. Each degree program, each university, each school has their own thing, and they have their own take on how they implement their degrees. Okay, there are some other options. So those are the 4 big degree programs. There are other ways to pursue a graduate degree in public health. One that we are very proud to have just started within this last year at Boise State is an accelerated program. So students who are in their last year of undergrad as a public health or health studies major can apply to be an accelerated MPH student in their senior year of undergrad. And so what that means is that the student can take up to 12 credits of graduate level coursework that will count towards both their undergraduate degree and their master's degree. And then once they graduate with their undergraduate degree, it is possible to then complete the MPH in 1 year full-time rather than the typical 2. So that's kind of a cool thing. Boise State is not the only place that does this. There are other universities. Sometimes they're called 3+2 programs or 4+1. Here it's accelerated. There are also dual degree programs where you might complete the requirements for 2 complementary degrees, either in parallel or one right after the other, where some of the courses for 1 degree could count for the 2nd degree as well. So these are just 2 examples. You know, you might get an MPH and an MSW. So MPH being the Masters of Public Health and the MSW being the Masters of Social Work. A lot of, you know, how we orient ourselves in public health is very similar to how folks in social work are also oriented. And so many of our classes could have connections and overlap. And so there are opportunities for a dual degree in that kind of a situation. Also, in medical schools that have MPH programs, you might find a dual degree for an MD or a DO and an MPH. So thinking about how do we provide those medical providers, those one-on-one medical providers with a broad public health background, thinking about systems and thinking about policy and community level change, in addition to their treatment and individual level change. And then the last thing I have up here is certificates. So a certificate would be something in addition to your undergraduate degree, a select set of classes that are designed to provide you some kind of specialized training. Maybe to take like 12 or 16 credits worth of classes, but not get the full master's degree. So if you graduate with an undergraduate degree and you're interested in like at Boise State, we have a certificate in health management and leadership. So if you graduate with an undergraduate degree and you're interested in pursuing health management and leadership, or maybe you already work in a public health organization and you kind of want to level up and you want to take some extra coursework to kind of improve your current position, then If you're not interested in getting the full degree, maybe getting the certificate would be the place for you to start. And you would complete those classes and then get an actual certificate and a transcript that shows that you have completed these classes and have a certificate or specialized training in whatever it is that the certificate was for. So those are kind of the big things, especially the stuff that you'll find in Idaho. In terms of public health degrees in Idaho, the Idaho State University and Boise State have both MPH programs. The Boise State University has a PhD program in public health leadership. So it is kind of a blend of a DRPH and a PhD. And I know that the University of Idaho has public health folks and an undergraduate degree in things like health education, which is very, very in the world of public health. So there are options throughout the state of Idaho for some of these degrees or certificates. Okay, so here's where I'm going to ask you to play along for a little bit and chime in if you have access to your microphone. So I have here on the left side a list of benefits or reasons to pursue a graduate level education that I came up with. So top on my list was career advancement. When I graduated, these pictures are of me, by the way. When I graduated with my undergraduate degree in school health in New York State, I was initially certified to teach K-12 health education. In New York State, your initial certification is only good for 5 years. Within that 5 years, you need to have a master's degree either in education or in your field. So I chose to get a master's degree in public health. My student teaching experience wasn't great. 7th graders really wore me out, and I wasn't sure that the school setting is where I really wanted to be for the rest of my career. So I decided to kind of step outside of school health education and look to public health and community health education. So the picture on the left is me in 2006 when I graduated with my MPH. So the career advancement piece was important for me. Ultimately, I didn't end up going back to teaching or using my teaching certification in New York, but having the degree in the field would have allowed me to do that and have permanent certification. The next picture is the picture of me when I graduated from the University of Iowa in 2015 with my PhD in community and behavioral health within the College of Public Health at the University of Iowa. At the time, when I started my PhD in 2011, I was working in a position where I had reached the top. There was no more advancement in terms of like promotion for me without a PhD. And so I started looking around and ended up at the University of Memphis, because at the time I was living in Oxford, Mississippi, and it was about an hour away, so I thought I could commute. Excuse me. And I would have stayed at the University of Mississippi, except they didn't have a PhD program I was interested in. So I started at the University of Memphis, and while I was there, my advisor, Sato Ishida, who is in this picture with me, took a new job at the University of Iowa and negotiated to bring me with her. So I ended up graduating from Iowa rather than Memphis. So for me, in both times of going back to school or getting a graduate degree, it was really about my career advancement. It was taking me to what comes next or what I needed to get to where I wanted to go. So some other things you might consider as benefits or reasons to pursue graduate education could be increased earning potential, deeper expertise in something that you are interested in, Also an increase in experience, maybe elevate your impact, be prepared for some leadership roles, have the tools to navigate complex issues and lead in response to crises, have the tools and research ability to advocate for science and science-based policies, conduct some of your own research, and teach or mentor. So these are all some of the things that would be on my list. So I'm curious, what would you add? So maybe those of you who are thinking about a graduate degree, or those of you with graduate degrees, what are some of the other benefits or reasons that you have or that you've seen for getting a graduate level education in public health? And go ahead and just pipe up.
Sure, I can go. I'm Adrian, and I would say that, I mean, it's kind of mentioned here a bit with it deep in expertise, deep in experience, but I think that comes from the type of schoolwork that we're doing. Like, I noticed a difference between my undergraduate and my graduate degree and the type of assignments and work that we were doing. It's a lot more applied work that we're engaging with, and a lot more practical, where we are engaging with other organizations. So there's networking opportunities. And oftentimes in some of our classes, we actually develop actual products that could be used with public health systems and organizations. So that's a big difference that I've noticed.
Great, thanks, Adrian. Anything to add?
Dr. Schafer is someone who's gone both through the MPH route and like yourself, and went on to do the PhD. I would probably say number one, I just love paying back student loans. That was my first reason. I just want to do
That's
that.
coming next.
That's coming next. No, but I think, obviously what we do here at Boise State University, teaching, a lot of those jobs, they expect you to have a PhD, a terminal degree. And also the, within the federal government, previously, they also wanted you to have a terminal degree. So I wanted to work for CDC and CMS. And so I just knew that in addition to teaching at this, there were certain employment opportunities that were going to require that terminal degree.
Yeah, good. Thank you.
Dr.
All right. Yeah, go ahead.
Just really quickly, I think one of them for me has always been to deepen my network, not just with the professors that you work with and other academics, but also with your peers and your students, and learning what they're doing and what their backgrounds are. It just broadens who you know and how you know them.
Great. Yeah, absolutely. I'm going to put that on my list. So for the next time I do this, it'll be on my list. Thank you. Okay, so Dr. Banks brought up he just loves paying student loans. Well, so there are challenges to pursuing graduate level education, and probably one of the biggest ones is financial burden. There are sometimes graduate assistantships available, in which you work a certain number of hours a week for the university, and in return, you get a small stipend and tuition reimbursement, and often some kind of graduate level health insurance. But still, even doing that, it's not like you're making a full-time income. And often even with assistantship, students might need to take loans or rely on a partner or other family to carry the load in those situations. So there is a financial component to getting a graduate degree, because the financial aid and scholarships are not as readily available at the graduate level as they are at the undergraduate level. The flip side of that, though, is if you work for an organization that will pay your tuition, then, it might be worth considering taking some classes part-time and seeing if you can balance it all between, which is the next thing, between your work, school, and just life situations. So for example, here in Idaho, if you work for the university will pay your tuition. Similarly, if you work for an organization like St. Luke's or St. Al's, they will reimburse you for so much of your tuition as well. So there may be some opportunities to kind of skirt around that financial burden. And public health is political. Public health is everywhere. Everything we do is public health. And so there are going to be political and policy challenges in pursuing a degree and pursuing a profession in public health. So, funding is subject to political shifts, which we're seeing right now. There are controversies over public health measures or mandates, and that you could have opposition in a politically charged environment. Some other things are that the job market can be fluctuating. So, during COVID times, we had a lot of people take early retirements or move on or experience burnout. And so the public health workforce, which was already sort of on a decline because of aging baby boomers and retirements and things, plummeted. And now, with the current leadership in our nation, but also in public health, there's a lot of uncertainty happening right now. We don't know what's going to happen in terms of jobs and funding and the job market. Working in public health crises can be challenging and can provide a mental toll. And then, at the PhD level or the DRPH level, having access to data can be a challenge as well. So let's take just one this time. Let's take one thing that you might add to this list of challenges. Okay, so the challenges I had were pretty deep. Okay, good, we'll move on.
Can I add something?
Yeah, absolutely.
I was just thinking graduate level, but maybe specifically PhD, if one is not planning to be in academia, I'm not sure how much, and I may be bold in saying that, but I'm not sure that how much would it really add to being, if you plan on being elsewhere, say, suppose in industry, I'm not sure how much PhD is really going to add, because I think PhD prepares you specifically for academia, and PhD specifically here in the US prepares you specifically for academia.
Yeah. Thank you, Priyanka. I think it depends on the institution as well. If you're being trained at a research institution, like an R1 or Research One university, then yeah, the people that are training you to be their colleagues. So you are looking, if you're at a place like that, like I was at the University of Iowa, as were you, Priyanka, then the people who are your mentors, they're your mentors because you want to be like them. And so that makes total sense in terms of PhD equals academic career. But I do think there are some other PhD programs, and I think the one at Boise State might actually be a good example of where, in addition to getting some of that research experience, you're also getting some of that applied experience and really thinking about how can you lead in an organization. So how can you lead in a health department and be able to take all of the information in that your epidemiologists are giving you and understand what it means. Maybe you're not the one doing all of the data analysis and writing the reports and that kind of stuff, but you have the knowledge and the education to do something with it. So I do think that that's definitely possible. And yes, thank you, Crudy. Visa challenges for international students. Absolutely. That is it's always a challenge, but it's an even bigger challenge right now. Okay, so how do you know if you're ready? These are, again, just some of the things that I would consider to be my my list is, you know, what are your career goals? Is a graduate degree going to get you to where you want to go in your career? What about funding? Are you at a place where you can afford, like financially, to pursue a degree? And then also, are you at a place where you can afford the time commitment to pursue a degree? Full-time, a master's degree usually takes 1 to 2 years. Full-time, a doctorate degree usually takes 3 to 5 years. And if you're part-time, it'll take longer than that. What kind of program do you want? Do you want one that's online, one that's part-time? Does it matter to you if you meet with people in person? How does it work around your family? Are you interested in a program that is accredited? And, you know, are you yourself looking for some certifications like the Certified Health Education Specialist or the Certified Public Health certifications? If so, then you're going to want to be looking for programs that will prepare you to sit for those exams and help you be eligible to sit for those exams. And then, you know, is based on the political and economic landscape of where you live, is this going to be the right choice for you and what you want to do with your career, but also thinking about burnout and things like that. How does this fit for you personally? So because I have a panel of students to share some of their considerations, I'm going to skip this one for now. So the next question is, okay, so I think I might want to do it, but is now a good time? And that's a really valid question. These 6 different news article headlines came out of the news just in the past like 2 to 3 weeks. So thinking about, you know, if you're going for a higher level degree like a PhD or a DRPH, often people will tell you, don't pay for your degree. If you can get an assistantship, get an assistantship, because that means that you'll be working with side by side with faculty and not paying tuition and all of those kinds of things. But that's becoming increasingly more difficult to do with threats to NIH funding. Labs and people who would typically hire graduate students to work with them under their NIH grants are a little hesitant this year in terms of hiring new graduate students because they're not sure if they're going to be able to continue to pay them or continue to maintain the current grant situation that they're under. So there's, like I said before, there's a lot of uncertainty around funding and opportunities right now. So I see that a question came into the chat about what are the prerequisites if coming from a different university or field. That's a great question. At the master's level at Boise State, there really aren't any prerequisites. I have been other places where they may require, you know, having had chemistry and a lab, or biology and a lab, or psychology and a lab. And if you don't have whatever maybe science they're looking for at the undergraduate level, then you might have to audit a class or something in your first semester. But typically for the master's level, the prerequisites for your undergrad are small. The PhD level or DRPH level, typically you need to have been working in the fields or have a degree in some other kind of degree in public health. Okay, so I'm curious, let's talk about this one a little bit. So thinking about these headlines and thinking about graduate degrees in public health, does this make you worried or like more motivated to just get out there and do it and get your degree and get to work being the change you want to see in the world? Worried and motivated. Good. Maybe the worry is adding to your motivation. Others? All right, so if you're in sort of this worried camp, you have resources. There are options and things available to you. So if you're thinking, yes, I really want to pursue a graduate degree, but I have some of these concerns or some of these worries, then my suggestion to you for your next steps would be to talk with people who are in the field doing the stuff you want to do and pursuing the kind of degree that you're considering. And so you may do what is called an informational interview. So maybe contact someone who, you know, works at a nonprofit or that works at the health department that does the kind of work you want to do and say, hey, I'm really interested in pursuing this degree, and I'd really like to know more about your job and how the degree might help me get to where you are, because I like what you're doing and I'd like to know more. I know that some of you on the call have been the interviewees in informational interviews before. And I can tell you that for the students who have done these, they really get a lot of benefit out of them. I would suggest also connecting with program directors, so people like me, your advisors from your undergraduate or your master's degree programs, even if you're no longer with that university or you've graduated, you know, those people are still there for you as long as they haven't retired, but their replacements can still be there for you. And, you know, also when you're doing an internship and working in the field, your internship supervisors can be really helpful for some of these kinds of conversations. And then, Katie, you know, back to your point, use your network. So this is a place where I can plug the Idaho Public Health Association. So nationally, there is the American Public Health Association, and in Idaho, we have an affiliate, IPHA. And being a member as a student costs $10 a year. So if you are a student now, I would suggest you join. And if you aren't a student, the cost is $40 for a year. And then just another shameless plug for IPHA. Coming up on April 7th, we are having a trivia night at Voodoo Brewing in Meridian. So anyone is welcome to join us, whether you're currently a member or not. And the cost is $10 for non-members. So if you're a student, I would say use that $10 to go towards your annual membership and then come and participate for free. Okay. So I'd like to transition over to our graduate student panel. Grace, I'm going to ask you to go first because Grace is the student that is getting her MPH currently, her Master's of Public Health currently. And then Katie will go to you. And so these are the questions that I asked our panelists to just be prepared to talk through with us. And so the first is why. Why are you or why did you pursue a graduate degree in public health? What was your process for identifying the program or the school that you wanted to be in? And how did you know when you found the one? What are some of the positive experiences and or challenges that you would like to highlight and thinking about what's important for people considering a graduate degree to know? And then what's your end goal? What do you want to be when you grow up? How does this get you to where you want to go? All right, so Grace, if you want to go ahead and unmute yourself, Grace provided a couple slides to kind of walk through this with us.
Awesome.
So take it away, Grace. Take a minute to just introduce yourself and then let me know when you want me to change the slide.
Okay, perfect. I am Grace. I am a first year full-time MPH student here at Boise State. I am in the data-driven emphasis and also obtaining a certificate in health leadership and management. Why did I decide to get an MPH? In my undergrad, I gained real world experience where I learned that public health was where I wanted to be. And I fell in love with it. I believe that public health for me is a one-stop shop of everything that I love. I get to collaborate with my peers, learn from them, leadership opportunities, and is very system forward. So really focusing on that interconnected work that we get to do, knowing that we can't do it alone. I love leadership, like I've mentioned before. And so obtaining this degree is one step to move up the ladder, like Dr. Schafer had mentioned before, to make real change. Why I received my bachelor's degree in health studies here at Boise State. I decided to stay and get my MPH here because I love the values of the School of Public and Population Health. They align with my values, and that was really the deciding factor for me. My professors that I had in my undergrad and that I currently have now really allowed me to find a home within the School of Public and Population Health and public health in the field. And I currently have a graduate assistantship with wellness services here at Boise State. I work on various different projects for our department and love it. So I think it obviously helped with that funding piece that we have talked about, which, yeah, it helps. You can go ahead on to the next slide. And my experience to get here, my undergrad was a journey coming out of state during COVID. I didn't really know what I wanted to do. And then I took some public health electives and was like, yep, this is where I want to be. Coming into my spring of my senior year, I had a lot of imposter syndrome just thinking about joining a graduate degree program. I didn't think that I really belonged, and still face that challenge sometimes. But I think my peers and my professors really embrace that we are all here for a reason, and that is for the work that we do. I wanted a challenge after getting my bachelor's and decided just to dive right into getting this degree. And I really wanted to focus on personal growth in and outside of the classroom. And I have loved all of the opportunities that have challenged me and have led to that personal growth. What is next after I finish up next year? That's the $1,000,000 question, the question that everyone loves to be asked. I think Dr. Schafer says this all the time, but public health is everywhere, and it will continue to be. And that's the motivating factor that I have during this challenging time. I love the idea of working in state public health. I love the idea of working in global health. I do think as of today, might change tomorrow, a PhD is definitely in the future for me. I love school. My high school self would have never said that, but I love to learn. And that is exciting. Yeah, so I'm excited for what's to come, and thank you guys for being here today.
Great. Thank you, Grace. Okay, Katie. Katie is here with us is a recent grad from the MPH program at Idaho State University. And Katie, your program is a little different in that it was online. And so If you could go ahead and share, introduce yourself and then share a little bit with us, that would be great.
Well, thanks so much, Dr. Schafer. Thanks for inviting me to be here. Thanks for attending, and I'm really grateful to be alongside these other panelists. It's a great opportunity. So my name is Katie Rogers, and I completed my MPH last August at Idaho State University. And my background before that was actually in medical anthropology, women's and gender studies, and religious studies. And I had kind of a meandering journey to get there, and actually had the opportunity to work alongside Charlene, who's on the panel, and Josie Graham, who's in the group here at the Department of Health and Welfare, and then transitioned to working at the University of Idaho. And in my different capacities, working with public health and medical anthropology and kind of blending together these interests, I kept on running into one of the things that you mentioned, Dr. Schafer, maxing out the fancy letters after my name were not enough. So career advancement was somewhat limited with just a bachelor's degree, but also I lacked the technical skills and training that I really needed to move into the direction that I wanted to go into. I needed more training in biostatistics and epidemiology in order to advance. And so that's what really drew me into the MPH, in addition to just being a part of the public health buzz, which is a really cool, exciting community here in Idaho. It's a small pond. And so there's some really amazing colleagues here, and it just kind of gets you excited to be a part of it. So my process for identifying a graduate program really functioned in a couple ways. So I can't underscore enough, and Dr. Schafer, you did a great job calling this out. I worked for University of Idaho at the time, which meant that my education was paid for. I'm still paying on my undergraduate student loans and had zero interest in acquiring more student loans. And so that education benefit was a pretty major deciding factor, not just to deciding to take the step and apply for the program, but also knowing that my time, I needed to maximize my time at the University of Idaho and get that done. I really appreciated the ISU program because my job was pretty hungry. I was working often more than 40 hours a week. And so having something online gave me the flexibility to be able to attend lectures when I could, but also work on the weekends, work late at night. I'm actually a really early morning worker, so I'd often wake up at like 3 a.m. and write some papers. So I appreciated that flexibility. I also planned a wedding in between there. So that was a really, really important part for me in order to figure out my work-life balance. I also really appreciated that ISU had CEPH accreditation. So it was an nationally accredited program, which I found really appealing. And I had also worked with ISU professors who were in that program in a professional capacity. So I was familiar with the faculty there and really appreciated not just who they were professionally, but also as people, and was excited about working and learning alongside them and from them. So positive experiences and or challenges that I want to highlight. I am really excited to hear other folks' perspectives. One of the things that I think of this is I think people who are driven towards the field of public health want to change the world, right? And I think Dr. Schafer even said, like, be the change you wish to see in the world. And I think because of that, and because of the nature of the field where we understand root cause analysis, where we understand all these different influencing factors, it's really easy to want to boil the ocean, so to speak. And so all of a sudden, this public health problem becomes this huge, massive thing, and it can be really, really difficult to identify a narrower focus to make real change. So that's one of the most exciting and I think challenging parts of this field. I've had the wonderful opportunity to serve on a couple different dissertation projects and boards, and that's often what and even with my own thesis rather, that I found really trying to narrow down what it is you're trying to change and how you want to do it can be really hard and is a really important skill to hone. So that's kind of my tidbit for that question or point. And it's fun. The MPH, at least my MPH, prepared me really well in order to do that. Um, my end goal. So what do I want to be when I grow up? Well, Idaho ranks dead last in the nation for physicians per capita. And the unique demographics of our state make it such that our providers and our whole healthcare industry is only getting stretched even further. So my professional aim is really to reduce burnout, support, and advance the health workforce. And then also ensure that our health systems remain fiscally solvent, so that they can continue to operate and really help serve patients in the state. We have some pretty significant health disparities, especially in rural areas. As long as I'm kind of working towards that goal and chipping away at that, I feel like I'm pretty much in alignment with what I hope to be. Um, one of the things, one of the projects, I guess, at work that I'm most excited about right now in the near future is I'm working on a sepsis project, where I'm tracking and hopefully helping to reduce rates of sepsis among patients who are discharged from inpatient settings. And so um, it's just kind of a cool way to blend, I think, the epidemiology aspect of things, the data and research side of things. I think I forgot to mention I work in population health equality at St. Alphonsus now. So I have the opportunity to work with providers every day to understand patient outcomes and really drive towards that. So that's my spiel. I hope I didn't take up too much time.
Yeah, thanks for joining us. Thanks for sharing. Okay, Brenna. Brenna is in her senior year at Boise State. She's just a few weeks away from graduating with her undergraduate degree and is completing her first year as an accelerated student. So Brenna, if you could take a minute and just share with us about your experience, please.
Yeah, of course. I'm Brenna. I originally had no plans of going to college. I'm a first generation student, so my family all went right into the workforce. And then just before COVID, I was working the same just reception job that I had been working for 3 years already, and decided in 4 years I can either still be a receptionist or I can go back to school and do something that I really wanted to do. So I worked for an insurance agency that had safety consulting, and I always thought that was so cool that they just went out in the field and talked to people. They weren't glued to a desk all day long. So I decided to go to a community college and start in public health there, and then it just kind of flourished. I met a girl in one of my chemistry 101 classes that was like, you have so much potential. She saw it in me. I didn't see it in me. And she was like, you can't stop there. Like, you should go on to Boise State. So I did. Didn't ever think I would make it this far in my education at all, but it's just been those relationships that I've built, professors that I met at Boise State that also saw potential in me that I didn't see, that have just continued to push me to keep going. So that's why I am where I am now. And that girl that I met in Chem 101 back at CWI is also in the MPH program now. We met again after not talking for so many years. So that's been really, really a cool experience too. For identifying a graduation program or a graduate program, like I said, started late. I didn't go right after high school. So I had already started a family. I've lived in Idaho basically my whole life. I've moved in and out a couple times, but I really set roots here. So I knew I wanted to stay in Idaho. And Boise State really was the best option. I have a full-time, I've been working full-time since I've been in college. So the night classes for the graduate program were just the best option for me. And it's been great. Somehow I don't get burnt out. I just love coming to class and seeing my friends and everybody. So that's been awesome. The only recommendations I would have for graduate programs is just be prepared for change at any point. Like I said, I've built my roots in Idaho, and I never thought that I would leave. And now coming up to time to submit grad apps for PhD programs, I'm like, maybe I should go to a different college for a PhD program. And then looking at those programs and seeing that their prerequisites are different than what Boise State's PhD programs are be. So you just be prepared for change at any time, because you may think that you're on one direct path and you have it all planned out, and then something happens and you change your mind. I do know for sure that I will go and get my PhD somewhere. I'm not 100% sure yet. Most likely Boise State, just because I love the community. Like Grace said, the community within the PhD program or the MPH program is just awesome. The community, the faculty, everybody's just so great. So I can't see any reason for leaving anymore. And then beyond that, I would love to do safety consulting still. I still find that job fascinating and would love to do that, and some policy advocacy for occupational safety as well.
Great, thank you.
Mhm.
All right, let's move to the PhD side. Alan is finishing, it's your second year, right, Alan, in the PhD program at Boise State?
In my second year, yeah.
Yeah. All right, so could you briefly tell us a little bit about your
Yeah,
experience, please?
and I'll go quick. I know we only have 5 minutes left, but I'm happy to chat offline. I put my email address in case anybody wants it, but I'll try and go quickly. But feel free to reach out. I'm happy to chat with anybody over the phone or a cup of coffee. Pursuing a PhD, a master's is not something to be taken lightly. But I think moving into the PhD world, I got 2 master's degrees kind of at the same time, and all the way on the East Coast for that. And it was like going to a shopping mall, and you just get clobbered with a ton of information from on multiple disciplines, right? And when I really started to work in the public health field, I started to narrow it down. And now I've gone from that shopping mall to a single aisle. And I'm able to double click and get a real good, deep understanding of policy and public health, the area in which I want to continue to focus. And so in looking for a program, Boise State was right where I wanted to be. I'm focused on Idaho policy. It allows me to stay here and tap into the deep network that Boise State has, and the policy analysts and advocates in this state, in this town. So Boise State was a easy fit, particularly after sort of interviewing the different faculty involved in the public health program, which I think is extremely important in choosing a program, and is really making sure you're aligned with the faculty, and not necessarily in their views, but in the work that they're doing. The research that they're conducting will help further where you want to be. And Boise State had that for me. So it was sort of a no-brainer in choosing Boise State. And I think some of the challenges come just with any program, particularly in public health. There's so many topics that we cover. Finding that niche, finding where you want to focus can take some time. And so I would highly suggest before a PhD program is started that you really have at least somewhat of a narrower focus than you did going into a MPH program. And to consider coming into it, I wish I would have known to be a little more organized with, having a citation software that you already use and that faculty use. And doing it full time has been beneficial because a lot of the classes and work I do they overlap. And so being able to stay focused has benefited me, but I know there are different, learning styles and techniques. At the end of this, I don't really see change in what I'm doing. There's not just an end and then I start a new trajectory in life. I want to continue what I'm doing in my PhD post. So continue teaching, continue doing research in my field. And really, life is just a continuation of what the PhD is kind of providing for me. So that's my goal. Yeah. So I hope that answers everything very quickly, Dr. Schafer. But I'm happy to answer any other questions offline.
Thanks, Alan. I appreciate it. All right. moving along to our slam dunk closer here, Charlene.
Hello, everyone. I'm Charlene Carrio, and I am already a fast talker, but I will likely go over the remaining 1 minute. So Charlene Carrio, I am a current DRPH student with the University of Illinois, Chicago. So this is a very busy slide of kind of my academic journey, and sprinkled throughout all of this is life. So throughout a bachelor's, my master's at Boise State, so I am a Bronco. I was working full time in a variety of different roles, and all of those kind of built towards why more schooling? What does this look like? How can I keep contributing in new and different ways? So why a DRPH? Alan shared his PhD journey. I really wanted a DRPH over a PhD. To me, the practice component is super important. I want to be the best practitioner. So in addition to being a student, I'm a current leader at one of Idaho's 7 local health departments. I get to lead our community health team over at Southwest District Health. And it's great to have one of our team members joining the call. So hi, Kaden. I wanted to be able to continue to build expertise in real world practice-based settings. And that's what a DRPH was able to do for me. Like other people had already said, lifelong learner, personal goal. But I actually want to be very clear about the true motivator for me leaning in and figuring out like doctorate program is for me. Maybe 5 or 6 years ago, I was cruising a job posting and I'm like, oh, this is amazing. I want to do this. It kind of filled my bucket in all of the ways. And I get to the very bottom of the posting and it said minimum requirement, doctorate degree. And I was not happy. I already had my application and my future office furniture picked out, but I needed this degree to make it happen. So that was really the thing that like lit a fire for me to really lean in and pursue kind of what a good fit for me might look like. So next slide, Dr. Schafer. I'll switch into, professional mode. So some things that I considered, and I would encourage you to consider as well, is what are your program options? So Ellen did a great job of kind of framing the PhD versus DRPH. So what kind of work do you want to do and what programs exist to make that happen? So if you just Google ASPPH degree finder, it will give you this really helpful search tool that allows you to say, I want these kind of things to achieve this kind of program. And it will give you all of those accredited schools that could be a good fit for you. So check it out. Also be really clear about what it is that you want out of a program. So you're investing a ton of time, literal money to get something out of a program. So for me, I wanted a live but still virtual program. I wanted to be going to school with people. I wanted to build out that professional network. And I wanted to feel like I was a part of something and feel really supported by the school. So those were all really important elements for me. And I found that through meeting with different programs, speaking with current student and alumni. Oftentimes during kind of application season, programs will have meet and greets or some sort of opportunity for future students to learn more about the programs. Go to those and trust your spidey senses. So for me, in that meeting with the University of Illinois, Chicago, there were a handful, maybe dozens of folks on this meet and greet call. And I got to hear from current students what they loved, what was a challenge about the program, alumni and how this program had helped them, and got to meet the professors. It was important. So I knew that I would fit in with this school, that it gives me the vibe that I want out of my graduate education, that I would be supported. My next kind of hot tip is make sure you're really clear about why you're going to a doctoral program or really any graduate program. Again, big investment. You are going to be balancing a lot of things. It is going to change your world personally, professionally, everything. So be really clear about what it is that you want to get out of it. You want to make sure you have the time to invest in that program and make sure that it's going to be relevant for kind of where you want to land, which is the $1 million question. Everyone will say, you're in this program. Well, what do you want to do with that? What's it going to do for you? So aside from that one job that like prompted me to apply to doctorate programs, you don't often see terminal degrees being required as a minimum element of a job posting. So keep that in mind. Just getting a degree is not going to be your golden ticket to a future job. Oftentimes, it's not even required. But for me, I knew that I wanted to continue being a content expert, to be a go-to leader in public health, keep contributing to my current team, organization, and the field in new and different ways. So I know through all of this that my jam, what superpowers I bring to the table are strategic leadership, workforce development, improving public health practice, all of that. And the DRPH program has really helped solidify all of that. So as promised, I did not go quickly, even though I spoke fast. I don't know if I was a slam dunk, but I'll throw my contact info in the chat so folks can reach out if they have any questions. But thanks, guys.
All right, thank you very much. So we are past time. These are just some resources, so links for Boise State programs and ISU programs. And I will say, though, I don't know, Dr. Banks, if we're allowed to do this, but I am happy to stay on the call for a few extra minutes if there are questions.
Absolutely, Dr. Schafer.
Great, great.
Absolutely. Please feel free to stay on. Like many others, I have to run to another appointment, but for those who have stayed with us and those who have questions, please do stay on. And my colleague, Joanna McCormick, will close out from our continuing education session. So thank you all.
And I would like to say another thank you to our panelists. Thank you very much.
Thank you, everyone. All right. All right. Well, this ends the formal session of the meeting. For those who have continued questions, please feel free to stay on. Thank you very much, everyone. Appreciate it.